ahead and hit record. So this is our week 2 presentation of our onboarding series, and we are going to jump right in. So let me go ahead and do a quick screen share. So this week is a little bit quicker than the previous week. I always try to kind of keep these calls around 30 minutes or so or under. That way you can enjoy the rest of your evening, because I know that everyone has things to do and families to feed and all the things on a Sunday evening. So let's get started with our week 2. All right, so this week we're going to go over frontalis injections and then also talk about some toxin rules. For MFL operations, we're going to go over offloading product and then also how to label product as well. And then we're going to go over our AR review, how you apply promotions and how to take wallet payments. And then finally, we have our marketing homework. All right, so this week, let's talk about the frontalis reviews. I'm going to pull this up real fast. So when you are looking at the frontalis, the big thing that you want to know is that you want to identify that there are large and small foreheads. For a large forehead, you do want to have at least 7 injection points. And for a small forehead, it's going to be at least 4 to 5 injection points. And I'm actually going to go ahead and I'm going to pull up. I'm going to pull up our toxin training so I can pull this for you. So we're sorry about that. Canva, there we go. Okay, so when we're looking back at our neurotoxin training that we did for the forehead, I talked about large and small foreheads. Again, a large forehead is going to have a minimum of 7, and a large forehead is going to have a minimum of 4. With the majority of having 5 or so. So if you look at this forehead right here, you can see that this is considered a large forehead. So this would be the standard 7 injection points. That first injection point is going to be between that pupil and that lateral canthus, directly in between there, and around 2 centimeters up, or 2 finger breadths up. That's going to be your first injection point, and you're going to put 5 fluid units. That would be 5 Dysport units, or the equivalent of 4 Botox. 2 Botox or 2 Jeuveau units. And then same, you're going to go medial canthus straight up, and then walking across the forehead, medial canthus straight up. And then again, the same from the pupil to the lateral canthus straight up. And then that very top row, you're now going to go pupil straight up, nose straight up, and then again, pupil straight up, for a total of 7 injection points. All right, so this is what a small forehead would look like. So you can see I have those 4 on that first row, and then this particular patient, she required 1 more. So I just did nose straight up, so for a total of 5. You do get about a 1 centimeter diffusion around each injection point, and then this would be a regular forehead. So you would see the normal 7 injection points, and then you would also see these 2 little pink dots. These are because this particular patient has little rainbows that kind of go across right above her eyebrows. And so I would do 2.5 fluid units kind of right at the hairline above these rainbows to kind of soften these lines. All right, so pulling up this patient, would y'all consider this a large or small forehead patient? You can say it in the chat. Large, large, large. Perfect. Yep. This would be considered a large patient's forehead. And I go ahead and you can see exactly how I would inject this patient. So between pupil, lateral canthus, lateral canthus, lateral canthus, between pupil, lateral canthus, and then pupil straight up, nose straight up, pupil straight up. So this is exactly how I inject this particular patient. This patient does not have any rainbows. She is not naturally hooded, so she does not need an eyebrow lift. So this is exactly what I would inject her. If I was using Dysport, I would inject 5, 5, 5, 5, 5, 5, 5. If I was doing Botox or Jeuveau, this would be 2, 2, 2, 2, 2, 2, 2. All right, what do you think about this particular patient? Actually, it's kind of cutting off a part of her forehead. But what do you think this patient would be? Yep, this would be a large patient's forehead. And then what does she have right above her eyebrows? What would you call those? Right around here. So these are her little rainbows, right? So she has a prominent rainbow on this side, not as much on this side, but she definitely has a larger one right here. So this is exactly how I treat this patient. So I do this little lateral injection here to treat this rainbow, and I do this little injection here to treat this one, and then she has a large forehead. All right, what about this patient? I want you to pay close attention to her rainbows that she has. So large or small. Would y'all consider this patient's forehead large or small? Can't tell. Okay, and then how many rainbows does she have? One or two? One. Yep, she has one rainbow on this side. So this is exactly how I would treat this patient. So this patient is considered a large forehead. So even if you there are very few small foreheads out there, but this patient has one rainbow on this side, so I would just treat it 2.5 above this one rainbow, but this patient does consider to have a large forehead. Let me try this one. What do you think about this patient? Large or small? Small, small, small. Very good. This patient has a very small forehead. She does not have any rainbows. And so this is exactly how I treat this patient as well. And so when you start seeing patients, if you ever have a question, go ahead and mark your patients and you can text it to me. All of you have my cell phone number, but if you don't have it handy, I can give it to you again real quick. My cell phone number is 832-230-7788, and I'll put it in the chat as well. That way y'all have it for easy reference. And I have no problem just kind of checking your markings. If you have a question, please send it to me. I will respond to you as quickly as I can. All right, so any questions on the frontalis review? And feel free to you can take questions in the chat or you can unmute yourself. Perfect. All right. Okay, so let's go over the toxin rules. So you do want to make sure that you are labeling all of your neurotoxin. So if you get a brand new vial of neurotoxin, it will have a sticker on there where you will put your initials and the date that you reconstitute the vial if it is a brand new vial. And recap again, remember that Botox and Jeuveau, it does not have a powder in it. It is a small freeze-dried ring at the very bottom of it. But no, if you are popping that cap, it is a brand new bottle of Botox or Jeuveau. It is not empty. Please do not throw it away. On that reconstitution bottle, on that box, you are going to put your initials, how much you reconstitute it with, and the date. Reminder that it is good for currently 30 days after reconstitution, according to the MFL rules. The product must be refrigerated, and please use new saline. Do not use old saline. Saline does expire, so I usually will not use saline past about a week or so after I have kind of popped that cap. Just because after a while, I feel like the saline kind of goes bad and it can impact the product. So really the best choice is to make sure that you're using really good saline, and then the product must be refrigerated before and after reconstitution. If the product gets hot, it can break open those protein chains and that product will no longer work. So please make sure that you reconstitute an initial and date. All of the information does need to go on the vial. The reason why we want you to say what you reconstitute it with is because we have some injectors who will reconstitute 1-to-1 ratio, and you need to know exactly what you're getting. And then also the expiration date, the product must be used currently 60 days after reconstitution. Any questions on any of these toxin rules so far?
Hey, Anne, this is Mary. Can you hear me?
Yeah, hi, Mary.
Hey, good evening. I do have a question. I didn't hit the unmute button fast enough, but it was regarding like the frontalis. Like, I mean, it's hard to tell in pictures. I think in person it's a little bit easier, of course, but like I know that we do 2 lines of injection. So if it's a large forehead, we do like 4 on the, the lower and then 3 above.
Mhm.
But It's 1 centimeter below the hairline, or like, can you?
Roughly, yep, roughly 1 centimeter below the hairline or so. And really, you want to always read the forehead like a book. You really want to inject where the wrinkles are. If you're not seeing lines 1 centimeter below and they're like 1.5 centimeters below, inject there. This is just a generalization, and every single patient's going to require like an individual assessment. But this is a basic outline of how you should be looking at the forehead. And then if the patient has some, kind of facial anomalies, like there was one patient that I showed you, she only had one rainbow versus two. Well, if she doesn't have two rainbows, you would not treat the other side. So same thing for if the patient is not really having movement that 1 centimeter below the hairline, it might be a little bit more. Feel free to just inject where those wrinkles are. Just make sure you're staying 2 centimeters above the eyebrows just so you're not preventing any type of ptosis.
Okay, thank you.
Yep. It says, Bethany, you said, are we supplied with saline or do you need to get some? You will always be supplied with everything that you need for MFL. So please do not buy anything. Don't buy needles, don't buy gloves, don't buy alcohol, don't buy saline. We will provide everything for you. We did actually have an injector who she ran out of saline. And unfortunately, she was in the Houston area, so we could have gotten her saline within 30 minutes if needed. But she decided to order it off of Amazon and did reconstitute a brand new bottle with product with saline that she had, or she thought it was saline that she had ordered off of Amazon, and injected the patient. Thankfully, nothing happened to the patient, but she did let us know what she did. So we did have to let that injector go because that's a breach of contract. And we do not know what she, obviously, if we're not ordering directly from a pharmacy, we have to keep our patients safe. So please make sure that you are not ordering anything, that you're not reconstituting with anything unless we provide it for you. We order everything from a pharmacy. And so everything can be ensured that it's sterile. Myra, to answer your question, the product is good 60 days after reconstitution. Okay, so this is exactly what the box will look like. It will have a little sticker on it, and this is a sticker that we actually put on the box. You'll put your initials, the date, what you reconstitute it with, and then the units used. This is a great kind of marker so you know exactly what is left in the bottle, and so you're not always having to go back into your traceability. You can see exactly what you have. So if I have a 100 unit bottle of Botox and I use 20 units because I just do someone's glabella, I would do minus 20. I know that I still have 80 units left in that bottle. So this is just an easy reference guide. And again, this patient, this looks like this is Dysport. That's why she reconstituted at 1.5. So she hyper concentrated it. And this is the reason why we ask you to do this, because some of our more experienced injectors, they will change the reconstitution to more hyper concentrated. And so we want to make sure you know exactly what you're getting. All right, so let's talk about how you're going to order a product. So in Bamboo, also on the Facebook page, both your onboarding page and the all MFL page, there is a link that is saved. If you simply type in product order link in the search bar on any of the Facebook pages, the link will pop up. It's also saved for you in Bamboo. It will ask you everything that you need. It will say, hey, do you need gloves? Do you need needles? Do you need, neurotoxin? Do you need saline? Whatever you need, just please place it in there. We do ask that you do not keep a large stock on hand unless you have patients already scheduled. So if you have a large Botox party coming up and, I am going to have, 6 to 8 people and they get, a lot of neurotoxin, their full face neurotoxin, I'm going to need, 4 vials of Botox and 2 vials of Dysport, then you absolutely can do that. We just ask that you don't have a stock on hand. So Stephanie will ask you to offload product if you are not going to be using it within 2 weeks. And so really that's kind of like our golden rule of thumb is only keep the product that you're going to use within 2 weeks. If you don't have patients lined up, please do not hold on to product. We do want to make sure that we keep that product in circulation. And then also for open product, I don't actually offload any product because I use the entire vial that I have, I will use within that 60 days. But if you are not going to use that entire vial, please offload it to another injector within your district so it can be used. So we do not have any product waste. So that's going to be kind of a big thing. If you do have a vial that is coming close to expiration of that 60 days, it is your responsibility as the injector to offload it prior to reconstituting, or I'm sorry, prior to it expiring. If you do allow product to expire, that's kind of why we keep that initial deposit from you, is to protect the company from injectors accidentally allowing product to go bad that we can no longer use. So please make sure that you are offloading product as needed. Again, if you're planning on using that entire vial, that's absolutely perfect. You can totally keep it. Just make sure you use it prior to the 60 days. Any questions at all about offloading product? Excellent. Okay, moving on. All right, so now I'm going to talk about promotions. So when we did our last homework the last week, we added a Disport. We added 50 units of Disport, and we also did a consultation fee. This week, I'm going to show you how to add promotions. And this is going to be if we are having a sale or if the patient is a VIP member and you need to utilize wallet credits. This is really where you're going to kind of learn how to do that. So whenever you finish charting out the patient, you're simply going to click this take payment button. You see it at the bottom where it says payment, and then under it says take payment. So go ahead and you're going to click that take payment button. As soon as you click that, it's going to pull up the current sale. So you can tell that I have 50 units of Dysport and 55 and one consultation fee at 55. Now I'm going to take my finger and I'm going to slowly drag this screen down. Here in a little bit, it's going to show that the Aspire rewards are manually kind of calculating in the background and trying to pull if the patient has any credits available for use. Remember that Aspire fully integrates with an aesthetic record. Jeuveau, while initially it did kind of fully integrate, it has been kind of hit or miss. So if it is available, then you absolutely can press it. Otherwise, please follow the graphic for the Jeuveau rewards. And that is 100% foolproof to do that graphic. And you just go through the .com for Jeuveau, and that works 100% of the time. For Botox, now, Allie has recently changed how they are doing their rewards. And this has actually happened within the last probably 3 weeks or so. And it's kind of shaken up the kind of med spa industry significantly. So they are no longer offering money off. They can now earn free syringes of filler. Is really kind of how it's working. They can earn Botox, but they have to have 1,200 points within a year. And that means that I think each time that they get Botox, they can earn 200 points. So even if you got your 4 treatments a year, you would still not qualify for a free treatment. You have to get several syringes of filler, and then they even want you to have some other the services that Allergan offers. So I think they're still trying to kind of figure out, because I think a lot of the med spa industry is pretty up in arms about how they're wanting to do it. So just let your patient know that while we can currently add their Alley points in the background, they do currently not get any money off. They basically just earn free syringes of filler is kind of how it's working. And it is only good for 1 year. So the points do roll off after 1 year. So just know that. But Aspire has not changed. So they get $20 off every single 90 days. And then for Jeuveau, they get $40 off every 90 days. So we're gonna go through this. I'm going to show you exactly how you're going to apply this. So again, you're going to take your finger. You can see how it's validating the Aspire rewards. So this patient has already cashed in a Dysport reward, and that's just because it's my test patient. That's the reason why. So you're going to take your finger and you're going to kind of pull that screen down, and you can see at the top it says products, promotions, and wallet. If we are running a promotion, you're going to go ahead and click on that promotion tab. And this is where all of our current promotions are. So if we have like buy two, save $140. If we have a friend and family's discount, if it's a certain kind of promotion that we're having for the month, you will simply select it or click on it. And you can see right now that patient owes $320. So I'm going to click on that friends and family discount. And you can see that when I did that, it took it down to $253.75 right at the bottom. And so that is a friends and family discount. Reminder that injectors do not get paid on friends and family discount. This is just a benefit to yourself. Please don't feel like you have to use this friends and family discount. Some of the injectors will actually use it for their salon owners as a marketing tool. So please don't feel like you have to utilize this because you will not be paid on it. It is more just a benefit to you as an injector. And then also, if you're going to be doing your self-injecting or your employee pricing, that is also going to be in that promotion tab as well. Okay, so I then go over and I click on wallet. You can see this particular patient has 600 alley points. Now, since I use Disport, they would actually be able to get $60 off this. So you would simply just click on that $60. Now, the Evolus one is going to continue to spin, and it should say, reward expired or whatever. So this particular patient has 600 points. So I'm going to click on that 600 points, and then I'm going to simply click on that $60. And when I do that, I'm then going to send the patient the code. And then I will type in the code to that little graphic right there, and it will take that $60 off. So fully integrated, which is great. All right. And then for this patient also has $10 in their AR wallet. So I'm going to show you how you could utilize that. Now, this is for if the patient is like a VIP member, or if they accidentally had, or if they tipped you and then we went ahead and we added it back to the patient's wallet. Because remember, we are not allowed to accept tips. It's considered illegal for medical people to accept tips. So if the corporate went back in and added that money back to the patient's wallet, if they're a VIP member, if they have a gift card, anything like that, that's the reason why you would use the AR wallet. You would simply click on select payment method at the bottom. And then from here, this is where you can choose if the patient wants to pay by credit card, cash. Cash would be Venmo or Zelle, or if you want to use the AR wallet. So go ahead and click on, at this point, you would click on AR wallet. And you can see the patient has $10 in their AR wallet. You would simply hit charge, and it would subtract that $10 from the patient's total. So now, instead of owing that $320, that patient just owed $310. I would then click on select payment method one more time, and then click on credit card or however the patient wants to pay the remaining balance. I'm going to click on charge, and then I would type in the patient's credit card number. Any questions about that so far? Ouch. It says my test shows AR. Your AR wallet is unavailable, Mary. Is that what you're saying?
Yeah, it shows that like I can do card cash, care credit, green sky, blah blah blah. But Air Wallet, Cherry, and Klarna are unavailable. So I didn't know if that was just a test thing or if that's something.
Well, the AR wallet is unavailable because there's no funds in there right now. So that's why it says it's unavailable.
Okay, makes
Yeah,
sense
and
then.
then Cherry and Caramel will be turned on after your launch party.
I mean, there's so many options for payments. I don't even know. So
Yeah.
okay, so good.
Yes.
Okay.
And Cherry it's a credit that the patient can apply to, and you do really everything just right from the app. It's very simple. I've never seen someone not get accepted for it. But yeah, for cash, you're going to be choosing, you can either choose, cash, or you can choose Klarna, and you can choose, the patient would Venmo the company.
Okay, and then as far as the Venmo, do we have like a QR code or like what is the Venmo to Venmo?
Yep. So it's going to be at my face lady.
Okay.
Yep.
Thanks.
All right, moving on. All right, so this week for the marketing homework, I'm going to have you reach out. So you created your Frank list last week. You are now, things get a little scary. Now you're going to reach out to 10 of those people on that list and start talking about your launch party and say, hey, would you be interested in coming to this, and start looking at some potential dates for it. Now, has everyone already been assigned their onboarding specialist? If you have not, please let me know. Perfect. Okay, good. I need an onboarding specialist for DFW. Okay, Grace, I'm gonna have you reach out to Ashley, if she has not already assigned you an onboarding specialist. Or you can just send her a quick text and say, Anne is, saying that we, will be getting an onboarding specialist. Do you know when I'll be getting that? Perfect. Does, everyone else have their onboarding specialist? Great. So you're going to go ahead and reach out to your onboarding specialist and start looking at potential dates for you to have your launch party. Once you have that set date, that's when you're going to start reaching out to do your 10 reach outs. Okay. Now, remember, you have to have a minimum of 3 people at your launch party for neurotoxin, and it can't just be 3 lip flips. The onboarding specialist must witness you doing 3 different areas, and this is according to our supervising physicians. So over invite people, okay? And their expectation is that they are going to be treated, okay? Even if they're just getting, hey, I'm just going to do 3 injections in my glabella. I'm just going to do little crow's feet. I just want to do a little, little dusting, whatever. The onboarding specialist must watch you inject, okay? Their goal and their role is to help you walk through aesthetic record and just to assure you that you know that you're confident in your injecting techniques and you don't have any questions. So really kind of lean on them. They're there to help guide you through your entire launch party process. Now, if you have any questions before or after, I am your go-to. I am your kind of mentor this entire time. So please feel free to call or text me if you have any questions. My goal in my role is to help you through this entire 8 weeks. So please use me as during these whole 8 weeks. If you have any questions, I am here for you. And then as far as homework for this week for social media, there are 2 different things that you're going to be doing. The first thing is you're going to post a before and after on your social media page of a patient's forehead that has been treated with this thing. Oh, I don't know what just happened. That was weird. Can y'all still hear me? That was weird. It just said recording in progress, and I've been recording the whole time. Okay. Well, let me go back to screen share. I'm sorry about that. That was very strange. Okay. That is going to be your homework for the week is you are going to post that education post. And then this is the week that I want you to start following additional people on social media. There is so much free education out there that you can tap into, and there are so many great accounts that you can learn from. Whenever you are starting this aesthetic journey, you have got to be a sponge and learn everything and anything that you can get your hands on. The good, the bad, and the ugly. You are going to see things on Instagram and TikTok that you're like, oh my gosh, I'm never doing it. But it is good that you can be exposed to that so you can see how other injectors practice and really kind of decide what type of aesthetic injector that you want to be. So I have selected 2 different accounts that I would like you to start to follow. The first one is going to be AAFE. This is actually another training institute, and they do a lot of training and education on their page. They really do have a great account. Then the second one is going to be Injector Bunny. Now, she does a lot more advanced techniques, but I think it's great for you to be exposed just to kind of see what else is out there. Now, AAFE does not do any type of liquid rhinoplasties. They're very against it, but I think Injector Bunny, I think she actually does. Just know that you are not allowed to do liquid rhinoplasties within MFL, and professionally and personally, I don't ever think you should do liquid rhinoplasties. I think they're very dangerous. But she does, just be aware that she does do them. So that way you can be exposed to all of the things that kind of goes along with aesthetic injecting. All right. Now, does anyone have, I cut off for about 60 seconds. Okay. So Bethany, your homework for this week is you are going to reach out to your 10 people. So you're going to talk to your onboarding specialist, get a date scheduled for your launch party. You're then going to reach out to your 10 people to invite them to your launch party. And then you are also going to post 2 times on social media. The first one is going to be a post that I already have for you, so you can just copy and paste. The second one is going to be an education post that you are going to make up about the benefits of neurotoxin. And then you're going to start following additional people on social media. The first one was AAFE. And then the second one is going to be Injector Bunny. And then all of this homework and information is going to be posted as well as the recording on the Facebook page. So the graphics, all of that stuff will be posted on the Facebook page for you by tomorrow morning. So that is it for today. Does anyone have any other questions for me? Should we encourage them to use rewards? Absolutely. Please encourage it. I always encourage my patient to use those rewards because it is basically free money. Again, talk to them if they are doing Botox. They no longer get money off for Botox because Allie stopped doing that. But for Juvo and Aspire, they get $20 off for Aspire and $40 off for Juvo.
I'm sorry, I have a question. I'm sorry, I kind of messed up on the typing here.
All right.
For the post for the before and after on the forehead,
Uh-huh.
can you use an example of on my face lady of the pictures that you have? Because since we haven't injected anybody yet.
Yeah, I already have the graphic for you. It's
Oh,
it's
okay.
something I've done in the past, and she's totally okay with us using her picture and over again.
Okay, thank you so much.
Yep, and that will be posted on there, so you'll just screenshot it, copy and paste.
All right, thank you.
And Mary, we can do Zelle and Venmo, just no cash. Jennifer, you said where you can find the social media release consent forms. So for your picture or for your patients at your launch party, that will actually be within aesthetic record when you are doing all of your consents for everything. There is a consent for social media and photo release. The Zelle number is what? Mary, that's going to be, there's a graphic for the Venmo and the Zelle phone number. So we'll make sure that is already on the onboarding page. There's a graphic there for you, but I will kind of bring it to the front. That way you can have easy access to it. Alrighty. Well, if y'all don't have any other questions, I will let you enjoy the rest of the Sunday evening. It's right at 7:33, so right around 30 minutes or so, which is great. I can't wait to see y'all next week. Please tag me in your post. I will comment in it. If you also want to follow other injectors within MFL, or even in your onboarding group, the more people that will comment and like the way that social media algorithms work, it will make it to where it is more visible for other people to see. So please reach out to fellow injectors. You can also go onto the all MFL injector page and ask people to follow you. They absolutely will, and they will comment on your page. So please use that entire community to your advantage. All right, ladies and gentlemen, y'all have a good evening. I will see you all next week. I have a Facebook group. Should I make a business page? That is that is a personal preference. If you would like to, you absolutely can. We do ask that, well, you don't ask, but I would recommend that you don't do any Facebook ads, at least initially. Don't, dump any money on doing any type of marketing yet. Start out with your warm market before you start to do anything like that. We want to make sure that this is profitable for you as an injector. So, all right, ladies, have a good evening. Bye.